Hi, Veronica. Thanks for coming in again today. I just want to check to see whether you're having any side effects with the medications you're on. Is that okay?
Yeah.
So I'll start just asking a few questions. In the last week, have you noticed any muscle stiffness, shakes, or difficulties walking?
Nope.
How about any abnormal muscle spasms that lasted for at least a minute?
Not really, no.
Okay, great. Have you noticed any restlessness or difficulty sitting still?
Nope.
How about any abnormal muscle movements?
Nope.
So I'm going to start then with a physical examination, if that's okay. So the first thing I'm going to do is just look at your face and see. When I'm observing the person's face for Parkinsonism, I'm looking for reduced facial expression, decreased blinking, or parted lips. In extreme cases, drooling or pooling of saliva may occur as well. Next, what I'm going to ask you to do is lean your hands over your knees with your elbows on your thighs like that. I'm just looking for any tremors or shakes. That's great. Excellent. Okay. Hold your hands up like this for me with your fingers apart. And what I'm looking for is seeing whether you have any tremor or shakes. That's great. And relax your hands. You can now just hold your hand up like this close to your face for me. And all I'm going to do is ask you to make a fist and open your hand and make a fist and open your hand and do that as fast as you can. Great. And now let's do it with the other hand. Fist, open, and do that as fast as you can. Excellent. Okay, great. So if you can just pass me your hand, please. Great. And just relax your hand. When I evaluate for stiffness in the elbow and the wrist, I place my thumb on the biceps tendon, and I move the elbow up and down, and I rotate the wrist in a circular motion. What I'm looking for is any stiffness or rigidity. I'm going to actually get you now to get up and walk for me if you could, okay? Why don't we just go over to the other hallway. When evaluating for Parkinsonism in gait, you're looking for decreased arm swing, shuffling gait, difficulties with turning, or problems with posture. Dyskinesias are movements that are repetitive, purposeless, and involuntary. When I'm evaluating for dyskinesias, I'm doing a head-to-toe scan, starting with the muscles of the face and mouth, looking at the tongue, the upper extremities, the trunk, including neck, shoulders, and hips, and the lower extremities. So if you can just next hold your hand up close to your face like this, that's great. And now all I'm going to ask you to do is to touch your finger to your thumb in sequence. 1, 2, 3, 4, 1, 2, 3, 4. Great. Can you do the same thing now with your mouth open? All I'm doing is I'm actually just using your hand as a distractor, and I'm paying attention to your mouth to see if there's any abnormal movements that are coming out. Akathisia consists of subjective feelings of inner restlessness with the urge to move and or objective movements such as restless movements of one extremity, changing position, rocking while standing or sitting, lifting feet as if marching on the spot, and inability to sit down for long periods with pacing back and forth. A severe score should be reserved for persons who are unable to remain seated for the entire 5-minute period. Dystonias are characterized by muscles which are contracted, contorted, and often painful, sometimes accompanied by repetitive jerking or twisting movements, resulting in the persons assuming abnormal postures.